You ever wondered if everything you've heard about mouthwash is true? We live in a world where mouthwash has become a staple in our oral hygiene routine. It's in our bathrooms, our travel bags, and even conveniently tucked away in our office drawers. Yet despite its widespread use, there's an ocean of misinformation swirling around this seemingly simple product. From claims that it stains your teeth to believe that it can actually cause cavities. It's clear that mouthwash has fallen victim to a myriad of myths. Some may even argue that the decision to use mouthwash before or after brushing is a hotly contested debate. And let's not forget the eternal question, alcohol or alcohol-free. So with all this confusion, how do we separate fact from fiction? Fear not, because today we're going to navigate this fascinating labyrinth and debunk some common myths. Let's dive into the world of mouthwash and debunk some common myths. First up, does mouthwash stain your teeth? Quite a colorful claim, isn't it? Well, let's delve into the facts. It's true that staining can occur, but it's quite rare, affecting only around 3% of people. The culprits behind these stains, certain ingredients like cetyl pyridinium chloride or chlorhexidine digluconate. But before you start panicking, let's clear the air. These stains aren't a permanent mark on your dental record. In fact, they can be easily polished off during your routine dental cleaning. So while it's easy to get caught up in the fear of having a rainbow smile, the reality is far less dramatic. Sure, there's a tiny chance your mouthwash could cause some temporary discoloration, but it's nothing a good cleaning can't fix. So no need to worry about your pearly whites turning into rainbow hues. Next, can mouthwash actually give you cavities? Now this is where things get a bit sticky, or should I say sweetly deceptive. Mouthwash in itself doesn't hand out cavities like candy at a parade. However, some types might indeed increase the risk. It all boils down to the alcohol content and the THC level. Alcohol can dry out your mouth, and a dry mouth is like a playground for cavity-causing bacteria. On the other hand, a lower pH equates to more acidity, which can erode tooth enamel and pave the way for cavities. So if you're prone to cavities, it's a good idea to opt for an alcohol-free and neutral, non-acidic mouthwash. Aim for a pH level around 7 to maintain a healthy balance. But here's the sugar-coated truth. Mouthwash isn't the villain in the cavity crime story. The wrong choice of mouthwash just might be an accomplice. Remember, it's not the mouthwash causing cavities, but the wrong choice of mouthwash could increase your risk. Now, should you use mouthwash before or after brushing? It seems like a simple question, but it's sparked quite the debate in the dental world. Some advocate for pre-brushing rinse. When you rinse before brushing, you're potentially washing away the fluoride from your toothpaste. Fluoride is a superhero in the battle against cavities, strengthening your teeth and fighting off tooth decay. So if you're a pre-brush or rinser, you might want to reconsider your routine. Here's a tip after brushing. Rinse your mouth with water, then follow up with a fluoride mouthwash. It's all about giving that fluoride toothpaste a chance to work. It's magic. But hey, everyone's mouth is unique and personal preferences play a part. So whether you're a pre-brush rinser or a post-brush rinser, find a routine that works best for you. Find what works best for you. But remember to give that fluoride toothpaste a chance to do its job. Finally, what's the deal with alcohol-free versus alcohol-containing mouthwash? Well, let's get our facts straight. The preference for alcohol-free mouthwash isn't just a matter of taste. Alcohol has a tendency to dry out your mouth, which doesn't just leave you feeling parched. It can actually increase your risk of cavities. Yes, you heard it right. A dry mouth is a playground for bacteria, those tiny culprits behind tooth decay. Now, that's not to say that mouthwash is the villain in your oral care routine. Quite the contrary. It can be a helpful ally when used correctly. But remember, it's not a standard for brushing and flossing. Those two remain your best defense against oral health problems. So before you reach for that bottle of mouthwash, be sure to read the label. If it contains alcohol, you might want to think twice. So when it comes to mouthwash, alcohol-free is the way to be. So what have we learned today about mouthwash? We've debunked some common claims stains are temporary and only affect a small percentage. While mouthwash isn't directly responsible for cavities, it's controversial whether to use it before or after brushing, and alcohol-free versions are generally preferable. The crux of the matter, mouthwash isn't a magic bullet for oral health. It's an adjunct, not a replacement for good old brushing and flossing. Remember, when it comes to oral health, nothing beats regular brushing and flossing.